Welcome. I'm Shane Stevens, Associate Director of Healthcare and Insurance at the Office of Personnel Management. Today I'm here to present 3 healthcare scenarios that highlight various medical and pharmacy costs you could incur based on a traditional health plan and a high deductible health plan, or a HDHP, which we'll refer to throughout the rest of the presentation. These are available to you in the FEHB and the PSHB programs. These scenarios will show you how members enrolled in a HDHP can fare better financially, and really just a comparison between 3 plans. So if you look at the slide over here, we have just traditional plans versus HSA qualified plans. And this is the typical plan design. These are plans out of our program, but what you're going to end up finding throughout this is you can compare and use this same concept to apply to multiple different plans that you may consider for you and your family. So to begin, it's important to understand a key difference between traditional PPO or HMO plans and HSA qualified high deductible health plans. Specifically, some health expenses such as copays don't count towards the catastrophic maximum in plans that are not HDHPs. However, under federal law and IRS rules, HSA qualified HDHPs must count all covered medical expenses towards the catastrophic maximum. And this includes deductibles, coinsurance, and co-payments. All covered in-network services include mental health, maternity, and prescription drugs. So once a member reaches the out-of-pocket maximum, they're fully protected from further costs for covered services. But for simplicity, our scenarios don't include those and other nuances. Additionally, to clearly demonstrate how deductibles and catastrophic maximums work, we're assuming the healthcare services occur in the order listed. So let's start with our first member scenario, wellness-focused Harold. So Harold is a special agent in charge, works in the intelligence agency. He works out 7 days a week and eats healthy. He gets an annual physical, but does not use other healthcare services. So we're going to use the same format on each of our slides throughout the presentation. So I'll take a little bit of time to explain this one. So in the first column, you're going to see the actual costs that flow through to the insurance plan. In the second column, you have your traditional insurance plan. And then you can look at each of the different rows, and that's going to show you the different areas of coverage and the different areas of cost. So you have your traditional plan in the second column, you have your HMO plan in the third column, and then the final column is a HSA HDHP plan. So during open season, let's get back to Harold. He's going to evaluate his options, and he determines that based on his low healthcare utilization, the HSA qualified HDHP is the best fit. This is because this is a plan that passes through $1,200 to his HSA, allowing him to save for future medical expenses. Now we're going to move over to our next person, and that's going to be ongoing care Carrie. So a similar scenario, and as you start to look and assess these, Carrie's going to have a lot more expenses. She's got some type of a chronic illness, so perhaps it's asthma or something along those lines. And although Carrie's not a high utilizer of healthcare services, her chronic condition means that she occasionally needs care. So over the year, she had an annual physical, she saw her primary physician and pulmonologist, visited the ER, filled a $20 generic prescription, and filled 2 non-preferred brand Acme brand prescriptions. So in that order, for total healthcare cost of $2,581. Now let's compare how each plan would handle these expenses. With the traditional PPO fee-for-service plan, Carrie would meet the $500 deductible with the ER visit. She would then pay $8 for the generic and 50% of the non-preferred brand Acme prescriptions, totaling $502. Her total out-of-pocket expenses would be $1,002, adding premiums of $4,992. Her total healthcare expense would be $5,994 for the year. So with the HMO, Carrie would not meet her deductible, and the non-preferred Acme prescriptions would not be covered. Her out-of-pocket expenses would be $1,868, including premiums, and then her total healthcare cost would be $3,740. With the HSA qualified HDHP, Carrie would meet her deductible with prescriptions. Her out-of-pocket expenses would be $1,830. Including premiums, her total would be $3,832. However, the HDHP passes through $1,200 to our HSA, reducing her net healthcare cost to $2,632 for the year. So as we move over to this next slide, there's more because Carrie contributed $1,830 for her medical expenses to her HSA before paying them using her HSA debit card. This gave her an above-the-line tax deduction, and for somebody, let's say, at 26% federal tax bracket, that's going to be a $475 savings, bringing her total healthcare expenses down further to $2,157. Now we're going to look at our final scenario. So this is complex care Sean, and due to a serious illness diagnosis, we could also look at a catastrophic type issue, something similar. Sean is going to be a frequent healthcare user. So over the year, he saw a primary care physician 10 times, visited oncologists and radiation oncologists 8 times, received 5 $20 generics, 5 $250 medications, 1 very expensive specialty medication, had 2 hospitalizations, and underwent $30,000 in radiation therapy. So he met his deductible with the prescriptions, and he hit the catastrophic maximum with the specialty medication. Now here's how the plans compare. Under the traditional PPO plan, his total healthcare expenses would be $10,992. Moving over to the HMO, they would be $8,372. And then under the HSA qualified HDHP, after including the $1,200 premium pass-through, his total would be $6,802. So next slide, we can finally talk about the HSA contributions for Sean. So the maximum contribution to a HSA for 2026 is $4,400. So after subtracting the $1,200 premium pass-through, Sean can voluntarily contribute up to $3,200. Doing so would result in $832 in tax savings, bringing his total healthcare expense, including premiums, down to $5,970. OPM offers a variety of tools to help you compare FEHB plans like the Plan Comparison Tool, state-specific plan info, and premium listings, all available on our agency's website. These resources make it easier to evaluate costs, coverage, and quality. If you need help, your agency benefits officer is a great point of contact. And you can also use other private tools, some of which are sponsored by your agency, such as Consumer's Checkbook, and that's a private sector comparison tool. But if your agency participates, it can even recommend a plan based on your specific needs. And depending on your situation, an HDHP might be the most cost-effective option for you. So please take advantage of the tools available on our website and through your agency benefits officer to make the most informed and cost-effective health plan choice this open season. We typically see about 5% of our plan participants move each year, and I'm hopeful that this video will help encourage people to take a true assessment of your health costs and the total impact financially to you and your family to show more movement to the best plan for you. So happy open season. Thank you for listening in.